Have you ever wondered if one of the simplest habits you've practiced every night for decades could be quietly helping your body, or slowly making life harder after the age of 75? Most people believe sleep is only about getting enough hours. They focus on bedtime, pillows, or mattresses. But what if the position you sleep in affects your heart, digestion, breathing, and even how refreshed you feel in the morning? And what if millions of older Americans have never been told the full story? There is one sleeping position that researchers have studied for years. Doctors sometimes recommend it for specific medical conditions, yet most seniors never hear why. The clues have been sitting in medical journals for decades, but the complete picture only becomes clear when you connect research from sleep medicine, cardiology, and digestive health. Stay with me, because one surprising detail near the end may completely change how you think about going to bed tonight. To understand why this matters, we have to go back much further than age 75. The story actually begins in early adulthood. When we are young, our bodies recover quickly, digestion is faster, muscles are stronger, the heart pumps efficiently, and many people can sleep almost anywhere without noticing much difference. Whether they sleep on their back, stomach, or side, the body usually compensates remarkably well. Small problems often remain invisible because healthy organs adapt. As the decades pass, however, those tiny differences begin adding up. During the 40s, many adults notice occasional heartburn, interrupted sleep, mild snoring, or waking with stiffness. These changes rarely happen overnight. Instead, they develop so slowly that most people assume they are simply part of getting older. According to American sleep surveys, millions of adults begin experiencing more frequent nighttime awakenings during middle age. Yet few ask whether their sleeping position could be contributing to the problem. Researchers studying aging eventually noticed something interesting. Certain sleeping positions consistently affected digestion, breathing, circulation, and even nighttime comfort. Scientists at institutions including the Mayo Clinic and researchers publishing in major sleep medicine journals found that body position changes how gravity influences the stomach, airways, blood flow, and pressure on internal organs. Suddenly, sleep was no longer just about time in bed. Position mattered to. Then comes the shift after age 70. This is where many seniors unknowingly reach an important turning point. Muscle tone naturally decreases. Connective tissues become less flexible. Acid reflux becomes more common. Sleep becomes lighter. The National Institute on Aging reports that older adults often experience changes in sleep quality, not simply because of age itself, but because multiple body systems begin interacting differently than they did decades earlier. Now the mystery deepens. Why do many physicians recommend sleeping on the left side for certain people? The answer starts with anatomy. Your stomach naturally sits slightly toward the left side of your body. When you sleep on your left side, gravity may help keep stomach contents lower than the esophagus. This can reduce nighttime acid reflux for many individuals. Several clinical studies have shown that left-side sleeping may decrease acid exposure in the esophagus compared with sleeping on the right side. For seniors who frequently wake with burning discomfort, coughing, or a sour taste in the mouth, this simple adjustment sometimes makes a noticeable difference. But that's only the beginning. Researchers have also explored how side sleeping may influence breathing. Many older adults develop mild airway narrowing during sleep. While sleeping position alone cannot cure disorders like obstructive sleep apnea, sleeping on the side often reduces airway collapse in some individuals compared with sleeping flat on the back. For certain people, this may reduce snoring and improve sleep quality. However, anyone with suspected sleep apnea should still receive a proper medical evaluation because untreated sleep apnea increases the risk of heart disease, stroke, and cognitive decline. The benefits continue. Some researchers suggest that sleeping on the left side may support more comfortable circulation during sleep for certain individuals. Although the effects vary from person to person and depend on underlying health conditions. During pregnancy, left side sleeping has long been recommended because it can improve blood flow. While older adults have different medical needs, This research helps scientists better understand how body position influences circulation throughout life. Now here's something most seniors never hear. Your lymphatic system, sometimes called the body's cleaning network, works continuously to remove waste products from tissues. Emerging research has also examined how the brain clears metabolic waste during sleep through what scientists call the glymphatic system. Although researchers are still learning how sleep position may influence this process, early findings have generated significant interest. The science is promising but not yet conclusive, reminding us that even simple habits deserve careful study rather than exaggerated claims. Unfortunately, many seniors reach a breaking point before making any changes. They begin waking repeatedly throughout the night. Heartburn becomes more frequent. Fatigue increases during the day. Poor sleep contributes to reduced physical activity. Less activity leads to weaker muscles, lower balance, and decreased independence. Medical appointments increase. Prescription medications multiply. Healthcare expenses grow. What started as disrupted sleep gradually affects nearly every part of daily life. The financial impact is often overlooked. According to American health surveys, poor sleep is associated with higher healthcare utilization, increased fall risk, and reduced quality of life among older adults. While sleep position alone cannot prevent these problems, improving sleep quality can become one valuable piece of a much larger healthy aging strategy. Sadly, many seniors still rely on outdated advice. Some believe sleeping flat on the back is always best. Others simply accept chronic heartburn as a normal part of aging. Many increase pillows without addressing body position. Some depend entirely on medications while overlooking lifestyle adjustments that might complement medical treatment. This is why modern aging research focuses on habits rather than quick fixes. Healthy aging rarely depends on one dramatic change. It results from dozens of small daily decisions repeated consistently over many years. So, what should you do if you're over 60? First, if you experience nighttime acid reflux, ask your healthcare provider whether sleeping on your left side may be appropriate for your situation. For many people, it can reduce nighttime symptoms, but individual medical conditions matter. Second, support comfortable side sleeping with a pillow that keeps your neck aligned and, if needed, place a small pillow between your knees to reduce pressure on your hips and lower back. Third, pay attention to your sleep rather than assuming poor sleep is simply part of aging. Keep a simple journal for 2 weeks. Notice your sleeping position, nighttime awakenings, heartburn, energy levels, and how rested you feel each morning. Small patterns often reveal valuable clues. Here is one important warning supported by medical evidence. If you experience severe snoring, repeated pauses in breathing, chest pain, unexplained shortness of breath, or persistent nighttime choking, do not rely on changing your sleep position alone. These symptoms may indicate serious medical conditions that require professional evaluation. And before you leave, here's one question to keep in mind. Researchers are now investigating another common nighttime habit that may have an even greater influence on healthy aging than sleep position itself. Most people have practiced it the same way for decades without realizing what it may be doing to their brain and heart. If you found this information helpful, please take a moment to like this video and share it with your family and friends. Someone you care about may sleep better simply because you shared this message. And if you want evidence-based insights that help you stay healthier, stronger, and more independent after 60, be sure to subscribe and turn on notifications. Our next video reveals the one nighttime habit that aging experts wish every senior understood before it was too late.